When we arrived here at Allegheny ARC, we found dozens of needs for new equipment, and we found dozens of existing pieces of equipment that were broken and needed service. It was very, very sad when we first arrived here to see how desperate things had become. Over the last 10 years, we've seen numerous cuts in our industry, and specifically the complex rehab industry. The result of all of this is that the profits in this industry are either at a bare minimum level or non-existent. It has caused many companies to go bankrupt. And the companies that provide multiple facets of the business, for example, do respiratory, standard durable medical equipment, and rehab, many of them have closed their rehab divisions. We will see many more casualties over this year and in coming years. Without question, there will be hundreds of Wellsvilles across the country. There will be many severely disabled individuals who are unable to get the products they need to maintain their lifestyle.
If it keeps going the way it's going, it's going to get worse, and it can only get worse. And then our people will suffer even more. We'll have more skin breakdown, we'll have more tightness, more muscles and bodies that curl up, that can't extend, more people not able to go to school or go to work. The people in government, the people in Albany, Washington, they're not medical professionals. So they don't see the patients that we see every day. They see their colleagues walking around, not a lot of them using wheelchairs. They don't see a lot of disabilities. And even when they do, they don't see behind the disability. They don't see the bed sores that happen. They don't see the contractures or the tightening of the muscles that end up staying that way that can never be fixed.
These are people that can't advocate for themselves. And as a therapist, I feel like most importantly is let me do my job. You're not allowing me to do my job and allowing them to live the best they can and to be as independent as possible without equipment and without people to come and service our area, allowing them to get new chairs when they need them. I mean, this is necessary. It's not just because we want new equipment, it's because they need it.
What legislators need to know is, I've mentioned it earlier, but to understand what we do. There's just such a huge misunderstanding right now, and we are unfairly categorized along with the rest of the durable medical equipment industry and DME providers. And they just need to understand that exactly what we do, and to understand the value of that and appreciate the value of that. The restoration of the 9.5% would help. It is not the final answer. The 9.5% was a cutback in 2009. It most definitely will result in more companies going out of the complex rehab business. But it would only get us back to the 2008 rates. In order for us to continue to survive, we need more than the 2008 rates. I think it's important to note that Wellsville, Allegheny ARC had an access problem prior to the 9.5% cutback. That just made it worse. It is nationwide. If we can have a problem like this in New York State, New York State isn't known, or when you think of rural areas, New York State is not the first state that comes to mind. You know, you think of states like Montana and Wyoming. This is a nationwide problem. I think the numbers prove that out. Where I see things going is, by nature, I am an optimistic person. I do believe that many of us in this industry are fighting the passionate fight. That we are doing everything we can to affect change. What I hope lies ahead is that we are able to make a difference. That doing videos like this to help educate our legislators and CMS will make a difference. Hopefully, we'll be able to look back on today and know we made a difference.